Community Analysis of Newport Richey, Florida by Amanda Peisel. A Historical View of Newport Richey. In December of 1883, Aaron Richey settled near the mouth of the Pithakuchee River and established the first post office, where he was the postmaster and became known as Captain Richey because he delivered mail by boat. Newport Richey was founded in 1911 when W. E. Guilford surveyed and drew up plans for the city's streets and avenues, which have not changed much since then. On December 22, 1919, Dr. Elroy M. Avery founded the Avery Library and Historical Society, which is currently the city's Library and Historical Society. In addition, Avery was the first mayor of Newport Richey. Sims in 1924 donated his land around Orange Lake, known then as the Enchantment Park, to the city residents, now known as Sims Park. Newport Richey is known to have been the Hollywood of the East to silent film stars such as Thomas Meighan, who built a home in the city. In addition, there were frequent spottings of Irvin Berlin, Paul Whiteman, Babe Ruth, Raymond Hitchcock, and Gloria Swanson. Screen comedic Ed Wynn opened the first motion picture theater. In 1926, Thomas Meighan's brother donated land for the construction of the Hacienda Hotel. The Great Depression ended the city's growth and attraction to movie stars and directors. The Hacienda Theater and some other historical buildings still remain as witness to Newport Richey's breathtaking past. As of today, Newport Richey covers approximately 4.6 miles and is considered to be in the Tampa Bay area. The population is 15,842 and is expected to continue to grow. Newport Richey's strategic plan places emphasis on the following: severe economic challenges, changing crime patterns, drug problems, high unemployment, declining demographics, high level of foreclosures, and increase in service demands. The city produces several events and activities during the year to generate economic activity. Their focus has been to revitalize downtown Newport Richey and to make it a place where people want to live. There are 16 elementary schools, 3 charter schools, 5 middle schools, 5 high schools, 6 schools that are D-rated, and 1 school that is F-rated. Higher education, there's Pasco Hernando State College, Marchman Technical Center, Benet's International School of Beauty, and Rasmussen College. There are 2 public libraries, the Newport Richey Library and Regency Park Branch Library. In 2012, there was a citizen survey, and the following were results of dissatisfaction percentages and areas of concern. Availability of reclaimed water was at 35.3%. People were dissatisfied. 25.8% were dissatisfied with stormwater drainage. 36.8% were dissatisfied with residential maintenance of properties. 56.9% were dissatisfied with rundown buildings. 40.3% were dissatisfied in animal control. For public safety, 63% were dissatisfied with crime. 78.4% were dissatisfied with drugs. 49.5% were dissatisfied with homelessness. And 35.1% were dissatisfied with panhandlers. Comparing Pasco County with Pinellas and Hillsborough County. Unemployment ranked highest in Pasco at 6.7%, compared to 5.8% in both Pinellas and Hillsborough. Severe housing problems ranked lowest in Pasco at 17%, compared to 20% in Pinellas and 21% in Hillsborough. Violent crime ranked lowest in Pasco, with 325 crimes in Pasco compared to 605 crimes in Pinellas and 394 crimes in Hillsborough County. Population, 15,842 people. There's 10.7% veterans, 23.9% over 65, 15.5% living with a disability under 65, 24.9% that are uninsured, 24.7% that are living in poverty, and 16.2% that speak a language other than English. The leading causes of death are heart disease, respiratory disease, lung cancer, stroke, diabetes, and cancer. According to studies representing underserved populations like veterans, females, elderly, and disabled and non-white, the top 5 concerns were hypertension, diabetes, cancer, weight, and heart problems. The healthcare needs of 65 years and older are only expected to increase to 20% of the U.S. population by 2030. Nearly a quarter of Newport Richey's population is 65 years and older. The healthcare obstacles for the elderly are the following: lack of transportation, uninsured, difficulty in understanding the healthcare system, poverty, lack of family support, culture, and race and ethnicity. The neighboring county of Hillsborough has the largest homeless population in Florida, followed by Pasco County as the second largest. Morton Plant North Bay Hospital is a not-for-profit community hospital located in Newport Richey. It has 226 beds, an updated ER, and a new intensive care unit, an inpatient rehab, a surgery center, and new imaging technology. According to Big Care, in 2015, there were 34,658 ER visits. The Medical Center of Trinity is located just outside of Newport Richey. It has 288 private beds and provides the following service: acute care program, ER, heart and vascular services, spine and orthopedics, cancer care, and women's health. The James A. Haley Veterans Hospital is located in Newport Richey and serves veterans in Pasco and surrounding counties. There are dozens of assisted living facilities and nursing homes in Pasco County or Newport Richey. There are community outreach programs such as Good Samaritan Health Clinic, United Way, and Pasco County Health Clinic. The Pasco County Health Clinic has 2 locations in Newport Richey and provides the following services: immunizations, WIC program, Healthy Start program, STD testing and treatment, and dental services. Healthy People 2020. Nutrition and weight status objective is increase the amount of adults who are at a healthy weight. The rationale is that obesity leads to increased risks of the following: heart disease, diabetes, and cancer. Improve the health literacy of the elderly population by increasing the amount of people who visit their doctors to be able to verbalize an understanding of their medical disease and how to follow their medical care plan. The rationale is that the elderly population need more time and extra effort from their medical care providers to provide an understanding of their healthcare issues and follow their treatment plans. Increase the amount of people who have their blood pressures measured to be able to verbalize whether or not it is normal or high. The rationale is that untreated high blood pressure has higher risks for strokes. There are 10 parks that are open to the public that are mostly free or charge a few dollars for parking. The park's amenities include some of the following: basketball courts, boat ramps, canoe and kayak access, fishing access, park benches, playgrounds, beach and swim areas, walking and hiking trails, and picnic areas. A few even are dog-friendly. The Recreation and Aquatic Center offer the following: 2 indoor gymnasiums, dance studio, game rooms, fitness center, pools, tennis courts, and skate park, but do charge an annual fee for membership. One area that needs improvement is the education to private well owners and septic system owners of the need to do routine testing on the quality of their water and safety and maintenance of systems. Preservation of natural areas is well maintained and well budgeted for. Drinking water is safe and meets the standards set up by the Environmental Protection Agency. Air quality index is acceptable, and there were 0 days where the air was ever unhealthy. There is a council-manager form of government with elected city council and a mayor who hold 3-year terms. The city council hires the city manager and establishes policies, ordinances, taxes, and budget management. Meetings are open to the community, and members and issues and proposals can be addressed to the city council at Vox Pop. The meetings do not seem well attended. The community's budget mirrors the goals of the community, which are the following: economic growth, revitalization of downtown, and infrastructure maintenance. There is adequate funding toward the police and the fire department. Community needs. Heart disease, because it is the leading cause of death in Newport Richey and it is the leading cause of death in the United States. According to the CDC, 27.6 million adults were diagnosed with heart disease. Cancer, because it is the leading cause of death in Newport Richey and the second cause of death in the United States. Obesity, because there are 30% of adults living in Newport Richey that are obese. Obesity is a global issue and more than 1/3 of U.S. adults are obese. Obesity increases the risk of heart disease, stroke, diabetes, and cancer. Smoking is a large problem in Newport Richey. During the windshield survey, there were numerous members of the community observed to be smoking. Smoking is associated with a host of health issues and is linked to about 80 to 90% of lung cancers. It also pollutes the air and litters the community streets. Substance abuse is a large issue in Newport Richey. An observation of the local emergency department and past nursing clinical hours at several hospitals revealed dozens of situations of overdoses or other drug-related complications of substance abuse. The following are facts about prescription abuse in Pasco County. 142 people overdosed from prescription pills. Pasco is number 1 for babies being born on prescription pills, and Pasco is number 2 in Florida for overdose deaths. Pain management. Pain management not being managed after surgical procedures leads to many negative outcomes such as patient suffering, prolonged hospital stay, and increased hospital costs. In addition, prolonged pain increases the risk for chronic pain, hypertension, DVTs, and anxiety. Worldwide obesity is a problem, and in 2014, 39% of adults age 18 and above were reported to be overweight. Obesity or being overweight increases your risk of developing the following: heart disease, hypertension, diabetes, gallstones, breathing problems, and cancer. There are more people that die from obesity than from starvation. According to a systematic analysis, there has been no decrease in obesity globally. Finland has seen an almost 50% decline in childhood obesity. Their health department streamlined all child care, education, nutrition, recreation, and urban planning department to provide the same services. They improved playgrounds, increased physical activity in schools, and eliminated sugary snacks. The Family Nutrition Program of Pasco County is part of the USDA Supplemental Nutrition Assistance Program and has many partnerships and collaborations with local agencies and organizations. The program is designed to educate on nutrition and promote physical activity, providing teaching in the classroom, cafeteria, gyms, media center, and school clinics. The Family Nutrition Program is also involved in the following: meetings with health department clinics, elderly nutrition services, food pantries, libraries, and summer camp programs. Pasco County began this program in 2007 with a substantial grant and funding, which has since then been greatly reduced. Community health nurse. A community health nurse could intervene by providing education and resources to the community about how to implement school programs and healthy diet plans. The nurse plays a critical role in increasing awareness of obesity and associated diseases. Community nurse should integrate teaching healthy lifestyles, diets, physical activity, and behavioral strategies beginning in elementary.